Hi guys, thanks for the invite. It's good to hear from folks on Proclaim. The program our team has been asked to present at CHA is a substance use intervention initiative called SBIRT, which stands for Screening, Brief Intervention, and Referral to Treatment. SBIRT is a patient-centered communication approach to healthcare, which uses questions and a lot of empathy to engage patients one-on-one about their substance use behaviors and encourage them to develop strategies in order to protect themselves. Now, our primary target population are at-risk substance users. For example, college students and other people who engage in binge drinking because they're at a much higher risk of addiction and dependency, which would eventually lead to the need for specialized treatment. Specialized treatment is unfortunately very expensive and harder for patients to access every year. Our goal is to sit down and have a frank discussion with them about the potential personal, financial, social costs involved, and to assist them if they're interested in moving their life in a different direction. A lot of those patients are very surprised to hear that alcohol-related injuries are the leading cause of death for persons aged 15 to 34. Our program has gained a good deal of attention recently because we've been looking to use undergraduate college students to do this work. Most other programs nationwide use medical staff and trained professionals in order to engage patients. But we've found that undergraduate college students with prior medical training, like emergency medical technician certification, are more than qualified of following the SBIRT methodology and screening tools. We've also been very gratified by their desire to serve the community locally and gain experience in a healthcare patient contact setting. We've been very incredibly impressed by their professionalism and by their desire to master the training regimen necessary, which involves lectures, group discussions, and role plays. They've really risen to the occasion, and we just couldn't do it without them. To show you what I'm talking about, here's a brief video clip.
So let's go into a couple of things that you like about drinking.
What do I like about drinking? Well, like I said, it's what my friends and I do. They really like to drink, and we have fun drinking.
Okay.
And also it does help me de-stress from the week and forget about homework and tests and things like that for a little while.
Okay. And what are some of the negative consequences you've seen from your drinking?
Well, obviously, I ended up here, so that's obviously negative. And the hangovers tends to affect the rest of the week, and my schoolwork and things like that. Like I said, my grades are not as good as they could be, and maybe drinking has something to do with that. If I'm hungover in class, or just spending my time on the weekends drinking with my friends.
Okay. So, in summary, it seems that the positives that you see is that it's a way to relax, to hang out with your friends, and something to do when you aren't studying. But we also see that you have hangovers that you don't enjoy, you've ended up in the hospital, and your grades are slightly suffering. So, all things considered, where does this leave you? On a scale of 1 to 10, how ready are you to change your drinking habits?
1 to 10, I'd probably say I'm a 7.
7. Now, why would you choose a 7 and not a 3?
Well, like we said, there seems to be more cons than pros. Like, it helps me de-stress, but in the long run, it's really affecting my schoolwork negatively.
Dave and Jacqueline did some fantastic work here. They put this together themselves based on their real-life patient encounters in the emergency department. We're indebted to them for so much more, however, especially referring people who request it to specialized treatment or putting them in touch with chaplains, counselors, social workers, whomever they feel would be most helpful to them. I really look at our program as a win-win-win-win. St. E's is hoping to reduce repeat emergency department visits. Boston College is looking to improve student awareness and behaviors regarding substance use. Our student volunteers are certainly taking full advantage of this real-life healthcare training opportunity and learning opportunity, and the community stands to benefit directly from improved quality of life and lower healthcare costs. Existing staff-based SBIRT programs like that of St. Anne's in Fall River, one of our sister hospitals, have already been shown to save nearly $6 for every dollar invested in SBIRT preventative medicine. Our volunteer-based model has the potential to improve on that margin significantly, and we're very excited to have that opportunity to have that discussion at CHA tomorrow. We're looking to so much more incredible things in the years ahead and we look forward to sharing them with you at some later date.